Thanks very much, Mr. Trehan, for taking the time out and speaking to us here on 80 Now. In terms of the budget, it has touched upon a lot of aspects, whether it's related to manufacturing, whether it's related to infrastructure, or capex push once again has also been given. But how would you rate the budget in terms of what was promised and what's been delivered?
So I think overall, if you look at it, for the health of the nation, you're talking about fiscal deficit being in control, and to achieve it and project it as progressively, although it's 0.1% per year kind of thing, but the fact that the promise was made that it will be below 4.5 and accomplishing it is a major achievement in this chaotic time also, where you know all the tariffs and all that stuff. So I think it was a very broad-based, linking the past to the future, in the sense that if you heard how many times Viksit was mentioned, that I think from that point of view it is keeping the momentum of the journey towards Viksit Bharat. Okay. Having said that, there were many issues that were addressed, and major one being manufacturing, because in this world, if we are to survive as a nation, or to do well as a nation, or to keep up our trajectory as a growth potential for our population, manufacturing is the backbone, and India is fully capable of it. We have the human capital, we have the industry to the only thing is to smoothen the process, and I think that's what was addressed also a little bit, that we need to encourage even in by contribution from overseas, going up to 10% by Indians who live overseas to invest rather than 5% in any business or industry. So all these things are very positive. Okay. Then also today the largest issue today in everybody's mind is rare earth minerals. So she talked about encouraging these 4-5 states which have the potential. So I think from that point of view, it was a well-balanced, forward-looking bridge between past and future. So I would rate it as a good budget.
Right. So let me also talk to you about, the medical sector, to be specific. In fact, medical tourism has been given a push. 5 new regional medical hubs will be launched, 3 new institutes as far as, Ayurveda for drug testing labs, and there is a, scheme for these medical hubs as well, and of course, for cancer medicines as well. How do you really look at these announcements? And by way of that, what do you think the focus of the government is with respect to announcements that have been made to the medical sector?
One thing that was missing was an overall statement on the allocation, budgetary allocation. Okay. But that can happen in the next few days, so that's not necessary. But the issues it was broad-based, addressing some of the issues, fundamental issues in health, what India is facing. Now, for one, the rapidly increase in non-communicable diseases, which include cancer, heart, diabetes, also obesity, all these things are actually rapidly rising in India. So if you say, what do we do about it? One is awareness, wellness, and that was addressed also, wellness by way of not only establishing more and more centers at the rural level, but also integration of modern medicine and Ayurveda, which can be serving our own people, and also a very powerful tool for medical value travel. So it dovetails into medical value travel, where you say India has the potential for doubling, tripling the number of people who are come to seek health or medical services for India, which, by the way, are the highest quality in the world at affordable costs. That's not actually projected properly to the world, and that's what we need to do. And the fact that the government has paid attention to the fact that this medical value travel is an important factor to develop, which has several benefits. Of course, it earns us foreign exchange. It establishes our reputation as the hub for high quality healthcare, and also it projects our soft power. So I think multitude of things happen if we encourage the formation of a very well organized sector for medical value travel, because that will enable us to be able to project it through all our agencies.
Right, sir.
Also. So that was addressed. Then the very important factor of skills, education, skills and employment. So, you know, healthcare is one of the largest employers in the country, second to agriculture. So the fact that there is a committee formed which will be education, skills and employment will also help. Then the other quickly will be mental health and senior care. So these are all issues that were addressed, which normally you don't in a budget. So I think that was important also, but at the same time, like I told you, what was missing. So I hope it will be rectified somewhere along the line, that we find out what is the budgetary allocation, because inflation is eating into or causing a cost escalation for all of us.
Absolutely, sir. It remains to be seen what the budgetary fine print is, but for the moment, thank you very much for sharing your thoughts and your feedback on the budget.